Good morning.
All right, my name is Roderick. I do work for ABC Dental. I did talk to you guys, some of you guys, last time I was here. ABC Dental, we're located on Old Spanish Trail in Calhoun. We have several different locations around the city. At that particular location at Old Spanish Trail in Calhoun, what I do is educate. And basically what I do is go around to the different schools and community family centers and things like this and just educate you guys on how to take care of your teeth. That's my other dental buddy back there. How you doing? So just to give you guys a couple of brief rundowns on just the education of oral health. If you guys don't know, and I'm sure a lot of you guys do, once your oral health goes bad, your general health falls behind. Everybody knows that? Yes. So that's the most important thing that you guys should know. Why it's so important to take care of your teeth. Once your oral health goes bad, your general health will follow behind. So we want to make sure that we're keeping a good oral healthy mouth. That's what we want to do. So with those, the things that I wanted to tell you guys, these are some of the rules that I do go over with some of you guys' kids. But the rules don't just apply to kids. They apply to us as well as adults. So one of the first rules that I have is brush your teeth 2 times a day. That's what we should be doing as adults, children. We should be brushing our teeth 2 times a day. The most important time for us to brush our teeth is when?
Morning and night.
Morning time is good for when you go to your coworker, you tell her good morning, you're going to knock her to the ground. But the most important time is when? Nighttime. At nighttime. So when we brush our teeth at night, can we have anything else to drink? No. We can.
We can drink some water.
Water, that's about it, right? So we can drink water. She thirsty, she need her water. So make sure it's water that you drink. Or if there's anything else that you guys drink, make sure that you guys rebrush your teeth again. I was talking to the young lady in the back and she was telling me she used to drink milk. Milk is great for your bones, but milk can be terrible for your teeth. Throughout the day, while we're drinking milk, that's fine. We have stuff, we all been blessed to have something that fights bacteria in our saliva. But when we're asleep, our saliva is asleep. So when we go to sleep, once we drink that milk before bed and we go to sleep, there's nothing to help fight off the sugar that's in the milk and all that good stuff. So it's good to drink milk for your teeth and your bones, but make sure at nighttime, if you guys want to drink a glass of milk at night, make sure you guys brushing your teeth again. Milk is good for the bones, terrible for the teeth. My second rule is brush your teeth for 2 minutes. 2 minutes. Not they fresh, I gotta go. I'm running late. 2 minutes. 2 minutes. So when we break it down to 2 minutes, and how you guys know you're properly brushing for 2 minutes, is just basically divide your mouth in half like this. And this half, the top half will be 30 seconds. The bottom half will be 30 seconds. 30 and 30, 1 minute. 30 and 30 on this side, another minute. We got 2 minutes. So we divide our mouth in half, and we brush the top half for 30 minutes, and we brush the bottom half for 30 minutes. We have 1 minute on one side, inside and outside, and do the same thing as well on the opposite side. So that's how we do the brushing the teeth for 2 minutes. If some of you guys like to sing your ABCs, go for it. Go for it. I mean, it works for the kids, but for adults, if you guys, want to just do the 30 up top and, and the 30 seconds at the bottom, that will work to do 2 minutes. Next, toothpaste. How much toothpaste should we use? A little bit or a lot?
A little bit.
Little bit. If you guys are using the toothpaste and you're making the S like they do on the TV, you're robbing yourself. You don't need that much toothpaste. You only need a dot. Only a pea size of toothpaste.
A pea size.
A pea size. Miss Hygienist, am I right? Only a pea size. You guys don't need a lot of toothpaste. I know they show you on the TV where they make it all pretty with the S and you want to do the same thing. Or you want to fill your toothbrush up and we put all of it on it. But you guys can save yourself some money by using just a pea size. A pea size will do the same thing. And when we're brushing our teeth, are we brushing back and forth like this? Straight across? Up and down? Small circles. When we're brushing in small circles, we should make sure the toothbrush hit our teeth and gums.
Oh.
The toothbrush should be hitting our teeth and our gums, not just our teeth. That's not how it works. That's why we do small circles so that the toothbrush can hit your teeth and gums. Also, the tongue. We have to brush that, right?
Right.
Right. Yes, of course. Okay. So when we brush our teeth, I've seen it done several times. when people brush their tongue, this is not the proper way. That's not the proper way, ladies and gentlemen. That is not the proper way to brush your tongue. The proper way to brush your tongue is, if this is my tongue and this is a toothbrush, I'm starting from the back of my mouth and I'm going to scrape out. Scrape out. That's what I'm going to do.
Scraping it like the tongue
You're
scrape.
going to start from the back and you're just going to scrape out. You ain't going to be doing like this. If you're doing like this, it's just like you're sweeping the floor. If you're sweeping the floor and you're doing that, the dust is not going where you want it to go. It's doing what it wants to do. The bacteria is not going where you want it to go if you're brushing like this. That doesn't work. So the proper way to brush your tongue would be to start from the back and scrape out. Give you a little rinse, start from the back, scrape out. Yes, ma'am.
I'm just having difficulty trying to imagine it because it makes you gag when you go all the way back there and
Yes.
then you got to turn your toothbrush. My mouth don't open that wide like that. I just do it that way.
Okay. Well, let me. If you're gonna do it this way, you might have to use mouthwash and all. You're gonna have to use mouthwash regardless. But the thing is, have you ever seen your tongue and it looks white?
I scrub it with a towel. I wipe it off with a towel.
Okay, and that'll work. That's some methods to work. A warm towel will definitely help if you can't get your toothbrush in there like that. But y'all seen have y'all ever seen this? Say for instance, a kid. Y'all take him to a field day. He have an icy and his tongue is blue.
Mm-hmm.
Why?
The flavor.
Bacteria.
But what does the dye have to stick to? The plaque. The plaque. That's basically what it sticks to. I mean, I see kids all the time. We go to that, they be like, "Hey, look, my teeth blue." I'm like, come here. It's not blue that, But once you tell them and they be like, "Oh." And it's like, now it's like, okay, we don't want that on our teeth now. Same thing with your tongue. When your tongue, you drinking this or whatever, if your tongue is, we might need to go do a plaque check. Let's do a plaque check. Let's get all the stuff off our tongue. The white tongues we don't want. Okay, we talked about the pea-sized toothbrush. Remember to floss daily. How many times a day should we floss?
After every meal.
After every meal? That's awesome. But at least once. If we can give ourselves floss at least once a day. At least once a day. That's some tedious stuff. That's very tedious. But it's very, very, very important. This don't have nothing on the floss.
You have some floss.
What you want to know?
Like
Don't
the
answer.
brush you made out of
Huh? No. These are, yes,
Bristles.
ma'am. Yes, ma'am. So what are these called again?
Bristles.
Bristles. These are bristles. And the other thing is floss. Yes, sir.
Okay, what does it matter if you use?
wax.
I'm talking about, the little floss.
The
Picks.
sticks.
Picks, or is it?
No, it's all a preference on what's you prefer. I mean, even for myself, I like the picks. They're convenient, but I mean they don't work for me. I mean one or two. I can go in between one or two teeth and they break again. I'm like, come on now. Yes, ma'am.
I was told the same thing.
What's that?
Pixels are not good. They don't get into
Underneath.
What's that?
the pixels.
The
They're not
picks.
good. They say do the old-fashioned way to put straight.
Well, that's the best way. That's the best way that I use.
Between the teeth, the pixels is gone.
Yes, that's the best way I use. Honestly, I do. I mean, even with the picks that I use, I mean, I don't like them. I mean, they're convenient to get something out between your teeth, just real quick. A piece of meat stuck in between your teeth. But as far as going actually down below the gum line, personally, I like the floss. And when you guys are flossing your teeth, make sure when you're flossing and you're going in between the teeth, make sure before you go in between one teeth and you go to the next one, make sure you guys are wrapping the dirty part and unwrapping the clean.
Boy, that makes sense.
It doesn't make any sense to floss with the dirty part and go right back in the same. I see people doing it all the time. But they're not doing it but transferring bacteria from one side to the next. Transferring. So when we are flossing, make sure you guys wrap the dirty, unwrap the clean. That's how we're gonna do that. Any questions so far? No? Okay. All right. Replace the toothbrush. You're gonna replace this every
2 months.
2 months. Everybody, every 2 months. If we have a cold, if I bought this yesterday, I have a cold this week. I gotta get rid of it. If I keep it after my cold, I put the same bacteria back in my mouth that I had when I had the cold. That's what I do. Visit the dentist. How many times a year?
Every 6 months.
Every 6 months. How many times a year is that?
2.
2. Yes, sir.
Okay, I gotta back up to the toothbrush. Another question.
Yes, sir.
Okay, I keep a travel bag.
Yes, sir.
I keep a toothbrush in that travel bag.
Yes, sir.
And I may use that travel bag and not travel there for 3 months.
Yes, sir.
Any concerns about that toothbrush?
Well, with that toothbrush, it depends on your travel. How often are you traveling? How often
I
are
might
you?
have used it a week, and then
Don't
it's
use-
sitting in my travel bag until the next time I travel, which might not be for 2-3 months.
Okay. Yeah, and with those type of situations, just try to use your best judgment on it. Everything. I mean, if you use it and you know you only, I've had it for at least a year, but I haven't used it no more than 3 times. I mean, just use your best
So
judgment.
no major concern.
No major concern. Just use your best judgment on that. And with the toothbrushes, a lot of toothbrushes, there's a lot of things people don't know. Once you use your toothbrush, and some people sit it down like this, some people have cups where they can sit it like that. If you have a cup like that, these are better. The bacteria that sits here, it doesn't have time to sit on your brush. It runs down. When you brush your toothbrush off and you sit there, your toothbrush, the bacteria just sit there. The protectors are good too. And when you have the protectors on there, if the toothbrush is up at an upward angle like this, it's more or less for things to run off than just to sit on it like that. Yes, more or less to sit like that. So far as the bottled waters, did I talk to you guys about the water last time I was here? Okay. Yeah, so bottled waters, we like the bottled waters, right? But everybody knows that the tap water has fluoride in it, right? And fluoride is basically vitamins for your teeth. Yes, ma'am. Time out. I got a question in the back. Yes, ma'am.
You said the tap water has fluoride.
Yes, tap water got covered. Because all y'all from Houston, y'all can't drink tap water no more.
How is that possible? Because if you take some water and you put it in the pot, all the residue on top of it.
What you have in the water that you probably may be concerned about could be lead. And a lot of
You tell me how to do what now?
the fluoride water, believe it or not, fluoride water has tap water has fluoride in it. A lot of other countries don't have tap water, fluoride in their tap water. Let's talk. I want you to understand.
I understand what you're saying, but there's a thing that be on top of the water. So brushing is fine, but not drinking. That's what you're saying.
What you mean? You get drinking it is good too. Drinking it is good. It won't kill you.
Yes, it will.
It won't.
Okay.
It won't, not too much. It won't kill you. Trust me.
Well, if you get a filter, but then you taking the fluoride out. If you get a filter, if you get a filter on your water, are you the fluoride coming out? Or
Hey, I work for a dental company. I don't work for no water. No, but I understand.
Just filtering out the particles, but I don't think it's taking out the.
Yeah. You even got some of the baby water that they have these days with fluoride in it. Yes, ma'am. But it won't. I promise. There's other methods to do it. If you don't want to drink the tap water, but you want the fluoride, they have nursery water for kids. They have some fluoride in it, so that might work out a little better for you. Okay. Okay. All right. Everybody know what fluoride basically does, right?
No,
Strengthen your teeth
Okay.
or what?
Yeah. So basically, what's like she said, fluoride is basically vitamins for your teeth. It strengthens the enamel on your teeth, and the enamel is basically the white part that you see on your teeth. It strengthens the enamel on your teeth, and it also helps fight germs and all that good stuff. All right. So, like I said about this board that I did show you guys, most of this part is for the adults, and we'll get a lot more in depth into those things here. And you guys have any family members that smoke or anything? Smoke? Any smokers? Y'all know what smoking does to the teeth, right? It changes teeth. It arises them. What about the gums?
Gum disease.
Gum disease. Do all of that. And also, your gums are bones, pretty much. The bones on your teeth. If you guys are smoking, or you have family members that are smoking, have you ever seen a person that looks like one tooth appears to be longer than the other? Yeah.
Is that from smoking or?
That's situations. One tooth is longer than the other. It may looks like that. Appears that their teeth are longer than they should be. And
long teeth in general?
long teeth in general.
Yes,
have you ever seen
I've
that?
seen it. Mm-hmm.
Yes. So basically that comes from The tobacco that you smoke, it eats away at your gum.
Oh, so
It
you
has-
have more teeth.
Yes, ma'am.
Your teeth start falling out.
Well, your teeth ain't gonna move. The teeth are not gonna move yet. What's gonna happen? Say for instance, if these are my teeth, these are my teeth, and these knuckles are my gums. As I smoke, the gums will recede. They'll go up, and the teeth will look longer. And you be like, what's going on with him? And so eventually, it'll go from being a smoker to people don't notice it right away, but as they smoke, the gums itch away, and so guess what? That leaves no support for the tooth. They coming. They gotta come. So the smoking, not only is it bad for just the cancer, it's bad for your teeth, your gums, and like I say, it's all of that good stuff. I mean, with teeth rule so much these days. I mean, when you see a person, the first thing they might look at when you say hello to them is seriously, your mouth. And I know women personally, myself. I'd have had ladies tell me the first thing I said when I seen your teeth and then I looked at your shoes. I was like, what? But I mean, teeth. Just imagine how important teeth is. I mean, if you're eating food, teeth is important, right? Very important. If you for appearance, teeth is important, right? And very important for speech. Teeth are important. So exactly, and people don't understand. If you go, I mean, right now today we all can go from having our own set of teeth to maybe some dentures or something like that. But we will notice the change in our speech if we did do that. You guys will know. So take care of the teeth that you guys have, and let's make sure we're doing the most important thing is taking care of our teeth. If we take care of our teeth, we take care of ourselves. Like I said, your oral health affects your general health overall. And so that's why I want to make sure that you guys are really on that and know that that is a very, very important part of your life is taking care of your teeth. This little toothbrush that I have is 40% of taking care of your mouth, and that floss is 60%. Which is most important? Flossing. But if I put them together, I got 100%. 60 for the floss, 40 for the toothbrush, 60 plus 40, 100. I got 100% clean mouth. If I get up in the morning and I only brush my teeth and I say I gotta go, I didn't floss. I'm walking out to Houston with a 40% clean breath. Nobody want to talk to me. Seriously. But if I get up in the morning and I brush and I floss my teeth, I'm ready for Houston. I got 100% clean mouth. Yes, sir.
You floss in the morning?
Yes, sir. Yes, sir. Yeah.
You mean after you eat, you floss?
No,
in the
I
morning?
floss in the morning.
Regardless.
You brush your teeth.
I floss in the morning.
Regardless.
I'm not talking after I eat. You're talking about like in the morning when you're doing the rest of your hygiene.
Yes, I get up and I floss.
But you don't have none.
Who don't? You don't know that. You didn't feed me last night.
Well, you said that we should brush our teeth and only drink water after we brush our teeth at night.
Yeah, exactly. But that's my preference.
So it's just a good hygiene.
It's a good hygiene practice. It's a hygiene practice.
So make sure now. Make sure we can't trip you up.
When I floss at night and I get up on the
Hold on. Let me get a question in the back. Yes, ma'am.
So let's say I sit down and have breakfast, I'm gonna have to floss again.
No, see, that's the thing. Everybody has their own time of day. Let's back up. Everybody back up. How many times a day did I say floss your teeth?
Once.
What's the key word in that sentence? At least. At least once a day. At least. You can floss. Y'all want to get us some floss? At least. The key word in my sentence, the key word in my sentence was at least once a day. If you want to floss 9 times a day, feel free to. But at least once a day, you owe your teeth that. At least once a day. Whether you get up and do it in the morning, if you get up and do it every morning, if you ain't ate nothing, that's your time of day you do it. That's your time of day you do it. See, I can do mine in the morning time and go throughout the rest of the day and just brush my teeth before bed and get up, and that's my routine. Every morning I do it. It's your preference on what you do, but at least get in between those teeth on the day. But you just ain't had nothing to eat. What you gonna do? Yes, ma'am. Yes, ma'am.
Oh.
Okay. Yes, so yes, ma'am. So I mean, with flossing, you guys create your own schedule on flossing. I mean, I got coworkers that I work with now. They eat lunch and they'll go brush and floss right after they finish. And me, I don't have time for it. Now, I do it in the morning time when I got it on my schedule, and sometimes I do it at night. It's just whatever convenient for you, but at least give your teeth once a day to floss.
Can't you damage your gums by overflossing?
You can damage your gum if you're going too deep into the pockets of the gum. If you're going too deep in the pockets of the gum, if you notice you're bleeding, maybe you're going too deep, or maybe that your gum's trying to tell you, hey, something going on down here. You ain't flossing me like you should be. When you guys see, and when you see blood when you're flossing, don't stop. When I say don't stop, you maybe stop for the moment when you see it. But when I say don't stop, period. Like, no, I flossed that last time, I'm gonna skip that. I'm gonna go, no, don't floss. Keep flossing there. And eventually, after about a week or so, and if you're still continuing to see bleeding, y'all come in and y'all see us or your primary dentist. Any more questions?
ABC Dental says, I thought it just was a pediatric dental.
No, ma'am. ABC Dental, we are a family dentistry. We see children. We do see adults too as well. We see the elderly as well too. So it's a family dentistry, general dentistry. Yes, ma'am. For the adults, we do accept CHIP and Medicaid for adults, and for the we say accept PPO insurance for and Medicare for the seniors. Yes, ma'am. Any more questions? Come on, come with them.
If you have PPO, are y'all doing free?
Nothing free. You can stop that question.
I call.
I'm sorry. It's a commercial on the radio.
I know.
If you have PPO, you have free whitening.
That's another.
That's mint dentistry.
You have it on
Mint.
Hey, let me tell y'all something.
One of them here.
Let me tell you something. When we ABC Dental, when we check with American Dental Association, we don't have free is not in our vocabulary. That's not nothing people should be doing. And and even Medicaid, that ain't free. We pay for it. Y'all pay for it. Everybody pay for it. You know what I'm saying? So when you go to a lot, I mean, with us being the dentistry that we are here in this neighborhood, we have a lot of competition. And when I say competition, we have a lot of things that's going on that's like, that we can't help but to continue to do what we're doing. It's families who goes to, it's dentists that go to several of the low-income apartments around here, and they go and pick up kids in vans and stuff, and that's against the law. It's against the law. A lot of y'all don't know it. That's why I'm here to educate you guys on that. ABC Dental, we don't provide transportation to anyone. We can't, but when we could, we would, but we can't anymore. The state said you can't do it anymore. We can't do it anymore. It's a lot of things that we used to do for the community here. We can't do it anymore.
But is it the companies that doing that? I thought those services were through like Medicaid or shit.
No, ma'am. Medicaid transportation has their own transportation. And Medicaid transportation is the transportation that every dental or medical provider should be using in this area. Not your own personal. Not your own personal. Yes,
So
sir.
how do we get them to look at broadening the insurance companies they accept?
The dental office? I mean, with time, it eventually happens. Because, I mean, from when I started with ABC Dental till the time that I'm here now, we have expanded in the insurance parts that we did. Like she stated earlier, she thought we was only for children. A lot of people do. But ABC Dental, we are a family dentistry. And with broadening the insurance, we're
With
just
the new healthcare laws and everything.
yes,
Yeah,
we're
it's
going over
more.
the different laws, and we're seeing what's the need in our community before we, switch the plans up. See what
We were trying to promote them on the staff, and I called to see if they accepted our insurance.
Okay.
And maybe the person, but they said no, so I had to back off.
You call ABC? Okay. Well, definitely, we can always work with you and, help you out. I mean,
Yeah, I'd love to, because it was one of the things we were trying to promote with our team.
okay. Well, definitely, we can always talk about that. But we always try to look and see what's the biggest need in our community and go from there. Yes, ma'am.
Like when the teeth turn, like when they look like gray or dark or whatever, does that mean that the enamel is all gone? And
Well,
possible other things?
what you may be seeing is possibly a cavity. When it's all,
All of them?
when it's gray,
All the teeth are gray.
side of that. They right. Yes, ma'am. I mean, yes, ma'am.
That explains a lot.
Yes, ma'am. Yes, ma'am. Any more questions? Feel free. So I got a couple toothbrushes for y'all.
Do you
Again.
have any flaws?
About no flaws.
Yeah, I got yeah. Yes, ma'am.
A brand.
Brand, your preference. Toothpaste, toothbrushes, toothbrushes. I will soft. That's what I was just about to tell you. Soft toothbrushes, no medium toothbrushes, no hard.
Why didn't you sell them? So is it worth it to buy? You know, like some toothbrushes are like $100 or one of is it worth it to buy those? Or is it? Are they comfortable?
Oh, those are like water picks or whatever.
Yeah, you know those kind. Are they worth it? Are they?
They are. Some of them are.
I mean, it's
The
again.
water pick I like because it's like you have like this fresh mouth and it goes like in between the gums and it gets, you know, like if you
The water
go
pick,
sit
yeah.
at
Floss
the
and
minutes.
brush
Yeah,
it
yeah.
at the same
And the
time.
power brush, the
Yeah.
power flow.
So,
I don't know about that. Does it really make a difference?
I mean, my personal opinion, I really honestly don't know about that because I mean, I haven't been in a situation where I had to use a spin brush. But I mean, I guess I go back to the slogan: you get what you pay for. But I mean, honestly, I mean, you know, when I look at a lot of those devices that they do sell now, such as the spin brush and things like that, a lot of those are replicates of the actual instruments that we do have in the office. Even the little spin brush is just like the little profit brush we use. So I think I mean, my personal opinion, I haven't used them, but I think so just based on looks.
my whole thing is when you brush and floss, you're gonna get the same
Feel.
as you would if you used the water pick. Because I've used both of them. You use the water pick. Yeah. And I mean, you do it right, you're doing the same thing. It's just that with the water pick, it's like you're at the dentist.
The water pick is like
And normally the water pick is for people that have braces anyway. It's basically used for that because to get food particles out of the wire. Yeah.
That was about a bullet to like, but it worked because when he started going after getting his braces, he was brushing like he was supposed to, but he wasn't getting deep into the braces where he needed to be. So that was the investment I had to do.
Oh, okay.
So it worked.
Yeah,
Braces wise.
Okay. Yeah, I'm knowing with the braces because that's different with the braces. I'm sure that water pick helped out.
Buy a regular one for like $10 or $15 instead of paying $80 because some things that I have from a 9-year-old to get him to brush his teeth.
What you got for me? That's it? Anybody else? Come on.
I can tell somebody they need to go to the gym.
You need to go to the dentist. I'm gonna stop you now before it get too bad. You need to go.
It's just weird. This young lady that I work with,
Take your little one to the doctor.
it's like
Doctor,
she doesn't even have to. I mean, she just breathes, and you can smell. That's what I'm talking about with the gray teeth.
No.
All of her teeth are like literally like they're gray.
How?
And I'm just like, does she brush her teeth or, I mean, you know, what's going on with it? And she was laughing at the customer because the customer had asked me if I had veneers.
Mhm.
And I was like, no, they're my teeth. So she was like, oh, you have a nice set of teeth. So she was like, looking like, I think so.
Well, you got a lot more than that going on. Just,
Yeah.
just,
So you don't have to
Yeah.
tell her.
yeah.
Leave her a brochure or something. Put it on her desk.
Leave a brochure.
You don't have to tell her.
She gonna come back to her desk. Who put this on my
Well, I mean,
desk?
but you don't tell her. You don't tell her. I mean, it's less confrontational and I mean, it keeps it from being defensive directly with you.
Right.
So,
Well, that's what I was trying to avoid because, I mean, I hate when people that we work with, you know, they'll say like, oh my God, did you smell that? That smelled like whatever.
Oh wow.
But then they won't,
They won't tell her
They
anything.
won't tell her, and I'm just like,
Well, my suggestion with that, and then I understand how you don't want to come at her like directly, like, hey, look, it's a problem with me, which it really ain't. But you're trying to help her.
right.
The best thing I can say, just sound conceited. Let's go on a conceited run. I say she just talk about her teeth all the time. Let's tell everybody about, oh, my teeth nice. I need to go to the dentist. Just talk about yours all the time.
It all depends on how close you are.
See, this will turn into a whole woman
But isn't
conversation.
halitosis a medical condition, not just oral? You know what I mean? Halitosis.
I don't think I know it's just an oral.
Right.
Okay.
Oh,
They
yeah.
taught you things.
How much was it?
Oh,
No, I do. Oh, okay. So that's why you're talking about this Houston stuff. I think it was going out into Houston, Houstonians and stuff like that.
And she's a younger girl, and I see how, sometimes when they interact with people, so I'm just a little uneasy about, bringing that.
Don't jeopardize your work relationship and able to tell her that.
Having a conversation
I would put it
about
first.
teaching, bring it up.
Yeah, that's what I was saying. Basically,
How about tonight?
right. Just make a whole conversation about it. Every time you talk to her, if you don't want to make her feel uncomfortable, just talk about yourself or somebody in your family. Man, girl, I gotta go get my teeth. Oh, my teeth. Oh, I need my teeth out. Whatever. Just.
And then she made.
Pregnant too, and I'm concerned.
Oh yes,
You know what
and
I'm saying?
definitely when she's pregnant, her body is forming and more plaque and producing more of that stuff, and she really need to get into the dentist. Because now she producing for two now. She producing for two, and with two, she's developing a lot more plaque when she's pregnant.
So I'm gonna try what you said. You have some literature that you
Yes,
can,
I definitely.
I wouldn't jeopardize
Hey.
my working relationship and have other people talking behind your back saying, what right does she have to say something to somebody?
Well, I understand what
You
she's
open
saying.
a whole lot of, it's a whole can of worms.
Yeah, I'm too much of a open person. Yeah.
Well, no, of course not. I wouldn't do that in front of anybody. I'm just saying what people, they'll be like, oh my God, how do you talk to her or whatever? And I'm just like,
Your manager don't say that. Like when people complain so much, then maybe you should talk to somebody and handle you so you.
It all depends on how close y'all are.
Depends on what the
If y'all are
relationship
close,
is.
you can pull her aside and tell her anything. I'm sure she.
All right, y'all gonna stop talking about this later. We've been talking about her about 5 minutes now. We done.
You trying to help her out.
It's over.
I
It's
need
over.
my flowers.
Okay, so how many times a day we gonna brush our teeth? Twice. How many minutes?
2 minutes.
2 minutes. And how many times a year we gonna visit the dentist? Twice a year.
We're going to tell you twice.
All right. And at night, when we tell our babies to go to bed, go in there and go to bed, boy. Mama ain't brushed my teeth. Thank you, Mom. Let's give her a round of applause. Hey, y'all don't know how many times I have been to these schools and I've told kids, hey, make sure you brush your teeth at night. And kids, and I see them with their moms the next day, and their mom said, you almost got his butt whooped. I'm telling him to go in there and go to sleep, and he talking about he got to go brush his teeth. But y'all know at the same time, kids use them tactics. They remember what they want when they want to. Go in there and go to bed. He been up all day and ain't been thinking about it. Mama say, go in there and go to bed. Oh, I gotta brush my teeth that man. And then they throw me right under the metro rail. That man told me.
Under the bus.
So yeah, y'all make sure them kids are brushing their teeth at night. Y'all do the same. And thank you guys so much for your time. Y'all have any questions for me? Anything else? All right, thank you. And don't y'all give that lady no brochure.
Look, I think I take a little bit better with the brochure than if you said something to me. I'm like,
Another
reading
thing
the
too,
field.
parents, if you don't mind, I think come like every other couple of weeks and then restore things, and we were trying to build this craft connection with the kids. My goal next month is to build a robot out of recycled things like cereal boxes, toilet paper rolls, and
Over here at the forge? Over here?
yeah.
Okay.
I do it at the forge. I'm here for 4 hours. I'm actually here tomorrow, and I break down the class. But next month I want to build a robot, like with tape and tops and So if you have any toilet tissue rolls that y'all don't throw away, just send them.
What about the plastic jugs when the water come in?
If we have the top, I think the top.
Y'all need top? Okay.
Recycled material. Just
Making a room.
Yeah, we use duct tape, and it's different kind of duct tape, and you just basically take the toilet paper rolls and put them inside each other, you stick them on the box in the top, so like the knobs.
what's that project part here?
Yes.
We got them in office.
But she not in the shade.
When you come in office, we got that too. We got
She
that.
not.
Everybody got a bag?
And it be hard,
Yeah. Your business too. Thank you. Thank y'all so much. Y'all have a good night. Y'all drive safe.
But since we gotta change so much, you probably need to do it. I just changed mine yesterday. Probably drive by. We just drive by. Oh, yeah.
You don't have no floss in there.
I know.
You don't have no floss to it.
No. I just didn't make the rain.
Are you gonna come back?
Yes.
Don't forget floss. Now, how do you teach these children? I didn't wanna ask that in front of
You
you.
should. Man, my presentation to the kids is like awesome. You know, with the kids, we have. Matter of fact, I'll play it with y'all next time. I'll play a demo Jeopardy game with the kids. We'll split up. We'll play it with y'all.
Okay.
Because I need to teach them.
Oh, teach you how to.
My field and my kids.
What?
Floss.
Okay. Yeah.
Because I don't know how to get you, for me, my children, being in the back, and like it's hard. That's where I have my most problem.
That last one in the back. Everybody.
I used the
So to be,
the floss too.
Did we cut this off? It's still going.
No, you know how they have.
No, it's still